let's talk health. World Immunization Week is celebrated every year in the last week of April. The observance aims to promote the use of vaccines to protect people of all ages against disease. Immunization saves millions of lives every year and is widely recognized as one of the world's most successful health interventions. Yet, there are still nearly 20 million children in the world today who are not getting the vaccines they need. And many miss out on vital vaccines during adolescence, adulthood, and into old age. Using the theme, Vaccines Bring Us Closer, the World Immunization Week 2021 will urge greater engagement around immunization globally to promote the importance of vaccination in bringing people together and improving the health and well-being of everyone, everywhere through life. Joining us for further discussion on this is Dr. FEMI OYEKAN. He joins us via Skype from the United Kingdom. Thank you, Dr. OYEKAN, for joining us. Well, the theme for this year's celebration is Vaccines Bring Us Closer. Talk us through this theme in light of the COVID-19 pandemic, which is in its third wave in some countries.
Thank you for making me part of today's conversation. The theme, Vaccine Bring Us Together, is better explained even in the light of the COVID pandemic. It shouldn't have been a more clearer time to send out a strong message about vaccination, especially when you know that there are a lot of business that have gone down that may never come back, and when you know that by just taking this jab, you are not going to save yourself, but you save a lot of people around you. And when you look at the disparity again with the countries that have and the ones that don't have, and knowing fully well that flow of cash, flow of human traffic, all of that boils around health, vaccination, and all of. So it's going to be difficult for us not to raise this alarm even stronger at this time where it's looking like anybody that is vaccinated has like a green passport to travel anywhere in the world.
All right. We understand that despite the significance of immunization, as we speak, nearly 20 million children in the world today are not getting the vaccines they need because there seems to be a whole lot of focus on the COVID-19 pandemic. Let's bring this home to Nigeria as an African country battling the pandemic just the way other countries are doing. How would you say the country is faring so far?
Well, I'll say that it is very sad. I won't, as much as I want to come down to Nigeria, I'll also say that it's very sad the way the response from Africa has been so far. Africa has a population of about 1.3 billion. And so far, from the WHO response, about 16.6 vaccine dose was sent to Africa. But when you start hearing things like in Malawi, in South Sudan, people are not taking the vaccines are beginning to expire and they're beginning to return them. And you begin to wonder what the rationale, how can we save Africa as a continent from this kind of, I think it's an embarrassment, to be honest with you, when you look at the response from Africa that people, so some of these vaccines, people risk their life, people risk their job, people put everything on the line to ensure that they can get the war moving again. But and when you see that people in Africa are not responding, like you rightly said, that 20 million children globally are not receiving these vaccines. And other, not just COVID vaccine, other vaccines. But you know the important thing, 61% of those 20 million are from Africa. Nigeria, South Sudan, South Africa, Egypt, and name them. And you'll be wondering, and even maternal mortality, all the death rates, all the data, it's just sad that the way Africa is responding to this is pathetic.
All right, Dr. OYEKAN, but if I may quickly come in here, but as it is, I don't know if I should call it quite fortunately for Nigeria, there's been some level of decline in the number of cases we're recording. Yesterday, for instance, the nation recorded 81 new cases of the virus, and so far it's 2,063 deaths relating to the pandemic. So don't you think the country has actually done some level of job, has received some level of accolade for what it's done in helping its citizens?
Well, I'll say that in terms of response with specifics to COVID, Nigeria and some African countries have done excellently well. But I also know that, being in Nigeria myself, that the figures Nigeria may be putting out, even though they are trying to do their best, might not reflect the actual happenings on the ground, because there are a lot of nooks and corners in the country that is difficult to get data from, and usually those are the dark places of the world, is where the evils are most eventually perpetrated. So when you give out those figures, it might not reflect the exact scenes that is happening on the ground. But what's important now is for Nigeria to join the business community, for us to join the global community, and for interactions to kickstart again across all levels. The vaccination has to be taken seriously. I'm not just talking about COVID vaccination, which at the moment is on top of the agenda. I'm talking about measles vaccination, polio, call them names, meningitis, rubella. All the vaccines are to be taken seriously. It's not just because COVID has become like the most prevalent disease that we're going to share with the other ones. Our kids are still dying for treatable disease, vaccine treatable disease. Those are some of the things we need to encourage even in the primary health centers, secondary health centers, and even teaching hospitals, that vaccination taken seriously.
Okay, it's also for people to go out there and get the vaccine. Thank you very much, Dr. OYEKAN, for joining us on Nigeria Today.
You're welcome.